When we think about feeling safe,
Mm.
we often picture ourselves maybe at home, tucked into bed, clean sheets, that kind of thing.
Mhm.
But but what if I told you that even the cleanest looking places can be hiding a whole unseen world?
A world teeming with microorganisms.
Exactly. And it's a world that we rarely think about, until maybe our health is on the line.
It's easy to forget that these invisible forces are constantly at play in our environment.
Yeah. And that's why today we're going to dive deep into this hidden battleground, this unseen world of hospital housekeeping. And before we jump in, a huge thank you to London Heartbeat Sea Academy UK for their ongoing support of these deep dives. I mean, seriously, if you find this kind of exploration interesting, and you're hungry to learn more, you really should check out their over 150 courses. I mean, there's something there for everyone.
Absolutely. London Heartbeat Sea Academy is a fantastic resource for lifelong learning, and their diverse range of courses caters to a wide variety of interests.
Yeah, and don't forget to subscribe to their social media channels like Facebook, Instagram, YouTube, so you can stay updated on all the amazing discussions they have going on. Now, okay, back to the topic at hand. You brought us a treasure trove of info today, all about hospital housekeeping, a topic that's honestly it's more crucial than most of us realize, right? Like we've got this detailed overview here, and it covers so much ground.
The sheer volume of information does speak to the complexity and importance of hospital housekeeping, how it's really a system with so many interconnected parts.
Exactly. And it's not just about like, mopping floors and wiping surfaces, which of course is important. We're talking about, how linen is managed, how they deal with waste, the whole security aspect tied into it all, even how dietary and transport services are supported within a hospital.
Hmm.
It's like a whole ecosystem of cleanliness and safety.
It really highlights that effective hospital housekeeping is a critical component of the healthcare infrastructure, impacting patient safety and well-being on multiple levels.
Okay, so for everyone joining us today, consider this your mission, your deep dive mission, to truly grasp what it takes to maintain a hospital.
Yeah.
To keep it clean, safe, hygienic, from those small everyday tasks to the bigger organizational structures.
Think of this as your fast track to becoming well-informed about the often unseen but absolutely vital world of hospital housekeeping.
Exactly. Okay, so let's start with the basics. What exactly is hospital housekeeping?
Well, when we talk about housekeeping in any setting, really, we're talking about creating a clean, comfortable, safe, and let's not forget, aesthetically pleasing environment.
Right.
But in a hospital environment, this definition takes on a whole new level of meaning.
Right, because it's not just about making things look nice, although though that's part of it, right?
Right. Of course, aesthetics matter, but in a hospital, it goes so much deeper. It becomes an integral part of patient care, of preventing the spread of infection, of supporting the healing process. It's really about safeguarding the health and well-being of everyone within those hospital walls, patients, visitors, staff, everyone. And another way to define it, as your materials suggest, is the meticulous maintenance of a clean, pleasant, and orderly environment. This idea of order and cleanliness, it's been essential for societies through our history, but in a healthcare setting, it's truly paramount for preventing disease and promoting recovery.
Okay, so we get the basic idea, but why is hospital housekeeping so critical? What makes it stand apart from say, keeping your house tidy?
There are several key reasons. First, and your material highlight this right away, is the aesthetic appeal. Now, I know that might sound superficial at first, but think about it. When you walk into any space, any environment, your immediate visual impression has a huge impact on you. A clean, well-ordered space subconsciously signals care, attention to detail, professionalism. And in a hospital where people are often feeling vulnerable, anxious, stressed, that visual cue of order, that can be incredibly reassuring.
Yeah, it's like walking into a hotel room.
Yeah.
A clean, well-made bed, brush towels. That immediately puts you at ease.
Exactly. And this visual appeal in a hospital, it goes way beyond just looking nice. It involves meticulous tidiness, making sure everything is in its place, from magazines in the waiting area to medical equipment in a treatment room. Even the care of indoor plants, the real ones and the artificial ones, falls under this. They all contribute to creating a positive, non-overwhelming experience for patients and their families who are already dealing with so much.
Okay, so aesthetic appeal sets the tone, creates that positive first impression. What's the next key reason why hospital housekeeping is so vital?
Hygiene. And this is where things get really serious. Hospital housekeeping isn't just about cleaning, it's a fundamental part of infection control. Every surface, every piece of equipment has the potential to harbor harmful microorganisms. So cleaning becomes an active way to remove those threats, to prevent the spread of infection. And even the housekeepers themselves need to maintain the highest standards of personal hygiene. Things like wearing clean uniforms, practicing good hand hygiene, ensuring their hair is tidy.
Right, because if the person responsible for cleaning isn't clean themselves, it kind of defeats the purpose.
Absolutely. And this focus on hygiene extends to the cleaning tools and agents as well. Disinfectants are crucial, of course, but there's also this clever system of color-coded equipment that many hospitals use.
Color-coded, tell me more about that.
So you've probably seen color coding in other cleaning settings, but in hospitals, it's really crucial. The idea is to prevent cross-contamination, right? So red. Red is universally used for areas with the highest risk, mainly toilets and bathrooms. So all the red cleaning cloths, mop buckets, everything red stays in the bathroom and is never used anywhere else.
Oh, that makes sense. So it's like a visual reminder, like, hey, this has been in the bathroom. Don't use it on the patient's bedside table.
Exactly. Then you have yellow for sinks and drains, blue for general furniture, and green specifically for kitchens. It's a simple system, but it creates a physical barrier to stop those germs from moving from one area to another.
Okay, color coding, brilliant.
Mm.
So what other aspects of hygiene do housekeepers need to be super aware of?
Well, the materials actually mention some specific qualities that a good housekeeper needs. Things like being really organized, having a good presence of mind, being able to work quickly and efficiently while still being thorough. And of course, being super cautious about spreading infection. It's a demanding role that requires a real understanding of the risks involved. And then, of course, there's the constant emphasis on hand hygiene, the regular changing of gloves and cloths, the proper disinfection of all equipment after each use. All these small details add up to create a much safer environment for everyone.
So hygiene and hospital housekeeping, it's like a multi-layered approach. Personal practices, equipment protocols, really thinking about the potential for harm. Now, let's shift gears a little bit and talk about maintenance. How does maintenance fit into the picture of hospital housekeeping?
You know, it's interesting. The act of cleaning itself, the routine cleaning that housekeepers do, it's actually considered a form of ongoing maintenance.
How so?
Well, think about it. Housekeepers are constantly moving through the hospital, cleaning different areas, different rooms. They see things, they notice things that others might miss. A loose tile, a flickering light, a door that's sticking. They're the eyes and ears of the hospital, in a way.
So they're not just cleaning, they're also like early warning systems.
Precisely. And their role in maintenance goes beyond just observing and reporting. They often follow up, they make sure those repairs are actually done, because a small issue, if it's left unaddressed, it can quickly turn into a bigger problem, right?
Yeah, like a leaky faucet becoming a flooded bathroom.
Exactly. And in some cases, with the right training, housekeepers might even be able to handle some basic maintenance tasks themselves. Things like tightening screws, changing light bulbs, even fixing a loose nail. And of course, taking good care of the cleaning equipment itself is part of maintenance too. Storing things properly, making sure everything is clean and in good working order, it's all connected.
Okay, so they're maintaining the environment and the tools they use to maintain the environment. It's like maintenance squared. Now, the final key reason for the importance of hospital housekeeping that you've highlighted is safety. How does housekeeping contribute to a safer hospital?
Well, first and foremost, they need to keep themselves safe. And that means using the right personal protective equipment, or PPE, like gloves, masks, gowns, goggles. They need to be protected from the very things they're cleaning up, right? But their role in safety goes beyond that. They're also trained to identify and eliminate potential hazards. And these hazards can fall into different categories.
Like what?
Well, you've got the obvious ones, the microbiological hazards like bacteria and viruses. Those are addressed through disinfection and sterilization. Then there are the physical hazards, things like clutter, spills, broken equipment. And then you've got chemical hazards from the cleaning agents themselves. Housekeepers need to know how to handle, store, and use these chemicals safely, how to label them properly, all of that.
So they're almost like safety inspectors as well as cleaners? It's a lot of responsibility.
It is, and it requires a high level of awareness and training. They're not just cleaning, they're protecting everyone within the hospital from potential harm.
Okay, so it's clear that a professional hospital housekeeper is someone who really understands these 4 key areas: aesthetics, hygiene, maintenance, and safety, and they apply that knowledge to everything they do. Now, what about the bigger picture? What are the overall objectives of hospital housekeeping?
Well, the ultimate goal is to create a clean, safe, and healthy environment for everyone, of course. But there are also some specific objectives that the housekeeping department usually strives to achieve.
Like what?
Well, for one, maintaining a good reputation for the hospital, especially for government hospitals. The cleanliness of the facility reflects on the quality of care, and meeting the expectations of the patients and the community. People expect hospitals to be clean. It's a basic expectation. Creating a welcoming, courteous, and efficient atmosphere, making sure there are enough staff and that they're well-trained and motivated. Building good relationships with other departments in the hospital, because housekeeping touches on pretty much every department in some way. Ensuring quality control of all the cleaning equipment and agents. Keeping accurate records and providing feedback, because that's how you improve things. And of course, good communication between departments so that any issues can be addressed quickly.
So it's like a well-oiled machine where every part needs to function properly to ensure the overall success of the hospital. Now, let's break it down a bit further. What are the core components, the key elements that make up a really solid hospital housekeeping program?
Your materials outline several key components, and they all interlock to create a comprehensive program. You've got the appealing interior decor, making sure the place looks good. Proper waste disposal, because that's crucial for both hygiene and safety. Infection control, which is at the heart of everything they do. Pest control, because nobody wants rats or cockroaches running around a hospital.
Especially not a hospital.
Right. Then you've got the fundamental aspects, the sanitation and cleanliness. Odor control, because bad smells can really impact how people perceive a place. Clean and appealing restrooms, because that's often a sign of how well a place is maintained overall. An adequate water supply, which is kind of essential for any cleaning. And then a bit of greenery comfort, some plants to make the place feel less sterile and more welcoming.
So it's a holistic approach, considering both the practical and the psychological aspects of a clean and healthy environment. Now, the materials emphasize that hygiene and cleanliness are especially important in hospitals, even more so than in other settings. Why is that?
Because hospitals, they have a much higher risk of cross-infection. You've got patients with weakened immune systems, people recovering from surgery, vulnerable newborns. Any lapse in hygiene, any spread of germs can have really serious consequences.
And the scope of hospital housekeeping, it's not just patient rooms, right? It's the whole facility.
Exactly. It extends to labs, offices, doctors' chambers, waiting areas, everywhere, even the mortuary. And the level of detail and organization in each area is really impressive. For example, they often use specialized cleaning equipment, things like vacuum cleaners with extra filters to trap even the tiniest particles to minimize the risk of spreading dust and germs.
Wow, so even the equipment itself is tailored to the unique needs of a hospital.
Absolutely. And even the cleaning methods can be different. For example, dusting in a hospital is usually done with damp cloths, not dry dusters, to prevent those particles from becoming airborne. And for sweeping, they often use mops that can be sterilized after each use.
Okay, so it's clear that they're taking every precaution to prevent the spread of infection. Now, let's focus on the people doing this important work. What are the key responsibilities of the hospital housekeeping team?
Well, their primary responsibility is obviously maintaining a high level of cleanliness and hygiene throughout the entire facility. But it goes beyond that. They're also responsible for safety and security, making sure the environment is safe for everyone. Pest control often falls under their purview, as does overseeing any contracted cleaning agencies. And in some cases, they might even handle the laundry for the entire hospital, patient linens, staff uniforms, everything.
So they're not just cleaning, they're managing essential services that keep the hospital running smoothly. And what about their specific responsibilities within the patient wards?
Within the wards, it's all about keeping the patient areas clean and comfortable while minimizing disruption to their rest and recovery. They're responsible for cleaning and making beds, arranging flowers, even handling patient mail sometimes. And a very important task is the terminal cleaning of rooms.
Terminal cleaning. What exactly does that involve?
It's the deep cleaning of a room after a patient is discharged, before a new patient is admitted. Every surface, every piece of equipment gets disinfected, and all the linen from that room undergoes a special high-temperature wash called a terminal wash to make sure it's completely sanitized.
Wow, that's really thorough. And what about those high-risk areas we talked about earlier, like the operating rooms and ICUs? Do the cleaning protocols get even more intense in those areas?
Oh, absolutely. In those high-risk zones, the precautions are incredibly strict. Everyone entering those areas must wear protective clothing gowns, masks, sometimes even more. Hand washing is absolutely crucial, and they use specially designated cleaning materials and agents that are either disinfected or replaced after each use. Waste from those areas is handled separately, and there are strict protocols for dealing with sharps, like needles.
Like a whole different level of cleanliness, almost like a surgical procedure itself. Now, healthcare is constantly evolving. Yeah, are there any modern trends that are influencing how hospital housekeeping is done these days?
Definitely. There's a big push towards using more appealing and calming colors in patient areas, moving away from that sterile institutional feel. More and more hospitals are adopting mechanized cleaning equipment, things like robotic floor scrubbers for efficiency and thoroughness. Odor control is a big focus, using techniques to neutralize unpleasant smells. And there's a lot of attention being paid to noise control, especially in patient areas. And of course, infection control is constantly evolving with new technologies and strategies being developed all the time.
So it's not just about cleaning anymore. It's about creating a positive and healing environment. Now, your materials categorize different areas of the hospital
Yeah.
based on their level of risk for contamination. Can you tell us more about those categories?
Sure. They're classified as low risk, moderate risk, high risk, and very high risk. Low risk areas are places like offices, waiting rooms, storage areas, places where there's not a lot of direct contact with patients. Moderate risk areas include general patient wards, outpatient clinics, labs, places where there's some patient contact, but the procedures aren't as invasive. High risk areas are places like the ER, the kitchen, the day surgery unit, places with a higher potential for contamination and where patients may be more vulnerable to infection. And very high risk areas, those are the most critical ones. ICUs, operating rooms, neonatal units, isolation rooms. These areas require the most stringent cleaning and disinfection protocols to protect the most vulnerable patients.
Wow, that's a lot of areas to keep track of, all with different levels of risk. And when you think about all the different things they need to clean, it's mind-boggling.
It really is. We're talking everything from baby baths to bed frames, ceilings to floors, sinks to toilets, wheelchairs to data points, and the list goes on and on.
So choosing the right cleaning agents must be a pretty complex process.
Right? Absolutely. They need to be effective against a wide range of microorganisms, but also safe for people and surfaces. They should be mild, non-corrosive, ideally have a pleasant odor. It's a delicate balance.
And your materials actually list some specific chemical constituents that are commonly found in hospital cleaning agents. Can you walk us through some of those?
Sure, some of them are pretty familiar, like ammonia, which is often used in glass cleaners and degreasers, and hydrochloric acid, which in a very diluted form can be used to remove stubborn stains. Even lemon juice can be used for certain types of stain removal. Then you've got things like linseed oil, which is used in some furniture polishes, and methylated spirits, which is a good solvent for cleaning glass and mirrors. Oxalic acid is sometimes used for stain removal and cleaning porcelain, while turpentine is mainly for thinning and removing paint.
Okay, so those are some of the more specialized ingredients. What about the ones we might recognize from our own homes?
Well, sodium hypochlorite, which is basically bleach, is a very common and effective disinfectant. And of course, plain old water is still a fundamental cleaning agent. Then you've got detergents, both soapy and synthetic, which are used for a wide range of cleaning tasks. And there's a whole category of disinfectants with different strengths and applications, depending on what you're trying to kill.
It's like a whole science in itself.
Hmm.
Now, to use these cleaning agents effectively, housekeepers have a specific vocabulary, right? What are some of those key cleaning terminologies?
Sure. We've got sweeping, of course, which is using a broom to remove loose debris. Wet dusting, which is using a damp cloth to pick up dust. Dry dusting, which is using a dry cloth or feather duster. Cobwebbing, which is specifically removing cobwebs. Spray cleaning, which is applying a cleaning solution with a spray bottle. Vacuuming, which is using a vacuum cleaner to remove dust and debris. Wet and damp mopping, which is using a mop with water and a cleaning solution to clean hard floors. Dry mopping, which is using a dry mop to dust hard floors. Polishing, which is applying a polish to a surface to make it shiny. Buffing, which is further enhancing the shine of a polished surface. Stripping, which is removing old layers of finish from a floor. Sealing, which is applying a protective sealant to a surface. And disinfecting, which is using chemicals to kill microorganisms.
So there's a specific term for every cleaning action, and each one has its own purpose and technique. Now, obviously, to do all this cleaning, they need the right tools, right?
Exactly. They use a whole range of equipment. Things like brooms, brushes, dustpans, mops, buckets, dust cloths, feather dusters, vacuum cleaners, spray bottles, even floor scrubbers and buffers. And of course, personal protective equipment is essential to protect themselves from the hazards of the job.
So a well-equipped hospital housekeeping department is like a cleaning army, ready
Hmm.
to tackle any mess. Now, before they even start cleaning, there's a lot of preparation involved, right?
Oh, definitely. First, they need to make sure they're dressed properly, wearing clean uniforms, flat shoes, hair tied back. Then they need to survey the area they're going to clean, figure out what needs to be done. Then they create a cleaning plan, a schedule of tasks, and they need to stick to that plan to make sure everything gets cleaned on time and to the right standard.
So it's a very structured and organized approach, not just random cleaning. Now, what about the principles behind all this cleaning? Are there any underlying rules that guide how they do their work?
Yes, there are some key principles that underpin effective cleaning in any setting, but especially in a hospital. The first is to remove all the dirt and grime without damaging the surfaces or the surrounding areas. The goal is to restore the surface to its original clean state. They also follow a top-to-bottom approach because dust and dirt fall downwards. And they work from the farthest point to the exit to avoid contaminating areas they've already cleaned.
That makes sense. That's like a strategic cleaning operation.
Yeah.
What are the principles do they follow?
Well, they always clean the least soiled areas first and then move on to the more heavily soiled areas. That way, they don't spread dirt and germs from one place to another. They also try to remove stains as soon as possible because the longer a stain sits, the harder it is to remove. Noise control is very important, especially in patient areas. They always try to reach every corner and crevice because those are the places where dust and dirt tend to hide. And of course, after they finish cleaning, they need to clean and store their equipment properly to prevent it from becoming a source of contamination itself.
So it's a really methodical and detail-oriented approach to cleaning. Now, let's break down the actual cleaning process. What happens when a housekeeper enters a room to start cleaning?
Well, the first thing they do is check their schedule and their cleaning plan for that room. Then they gather all the equipment and supplies they'll need. If it's a patient room, they knock on the door and announce themselves before entering to be respectful. Then they turn on the lights if needed and open a window or adjust the ventilation to get some fresh air circulating. They empty any trash cans and replace the liners, and then they start cleaning, usually by dusting the entire room.
And we talked earlier about the right order for cleaning tasks. Can you remind us what that order is?
Yes, the general rule of thumb is to dust first, then sweep, then mop, and finally vacuum. That way, any dust or debris dislodged during the earlier stages gets picked up in the later stages.
Okay, so dust, sweep, mop, vacuum. Got it. Now let's dive deeper into some of the specific cleaning techniques. What's the right way to sweep and mop, and how do they safely remove cobwebs from high places?
For sweeping, the key is to sweep away from your body using short, controlled strokes. You hold the broom near the tip for better control, and you push the dirt forward. It's like a little dance. For mopping, you generally move the mop towards your body, using a side-to-side or figure-8 motion, and rinsing the mop head frequently. And for cobweb removal, safety is paramount. You always use a proper ladder or step stool, never a chair or something unstable. For ceiling fans, you turn the fan off and carefully rotate each blade by hand to clean it. And for cobwebs in other high places, you use a cobweb remover with an extendable handle.
Okay, so technique is important for every task. Now, your materials also give some formal definitions and typical frequencies for these tasks.
Yes, sweeping or brushing is the daily removal of loose dirt and dust from surfaces like floors, furniture, and even outdoor areas. Dry mopping is also a daily task, where you use a dry mop to dust hard floors. And cobwebbing is usually a weekly task, focusing on those high, hard-to-reach areas.
So, keeping things clean is an ongoing process. Now, let's talk about dusting in more detail. We've already touched on the difference between dry and damp dusting. Can you expand on that?
Sure. Dry dusting is the basic, everyday dusting that you do with a dry cloth. You use it for furniture, windowsills, light switches, baseboards, things like that. Damp dusting is for when you need a little more cleaning power to remove grease, fingerprints, sticky residues. You use a cloth that's been dampened with water and a mild detergent, and you usually rinse and dry the surface afterwards. Damp dusting is good for things like windows, fan blades, doors, sometimes furniture.
So, dry dusting for general maintenance, damp dusting for more stubborn dirt. And are there any specific tips for dusting effectively?
Yes, it's best to dust in a consistent direction, either clockwise or anti-clockwise, to make sure you cover everything. Use good quality dust cloths and wash them frequently. For glass and mirrors, always work from top to bottom to avoid streaks. And don't forget to color code your cloths to prevent cross-contamination.
Color coding again, it's everywhere. Now, what about vacuuming and wet or damp mopping? What are those techniques best used for?
Vacuuming is great for Carpets, rugs, upholstery, and even hard floors to pick up loose particles. It's often done after dusting to collect any dust that has settled on the floor. Wet and damp mopping are for hard floors, especially in areas where there's water or spills. It's a deeper clean than dry mopping.
So vacuuming for dry messes, mopping for wet messes. And speaking of messes, spills are a fact of life, especially in a hospital. What do housekeepers need to have on hand to deal with those?
Well, first and foremost, they need personal protective equipment. Gloves, gown, maybe a mask and eye protection. Then they need something to absorb the spill, like paper towels. For sharp objects like broken glass, they need forceps to pick them up safely. And most importantly, they need a disinfectant solution to kill any germs. Bleach is a common one, but there are other effective disinfectants as well.
And spills involving blood or body fluids, those are especially concerning. What's the procedure for cleaning those up?
Those require extra precautions. First, you put up a warning sign to alert people to the hazard. Then you put on your PPE, gloves, gown, everything. If there are any sharps, you carefully pick those up with forceps and dispose of them in a sharps container. Then you cover the spill with absorbent paper towels and pour disinfectant over it. Let the disinfectant sit for a few minutes to kill the germs, then carefully clean everything up and dispose of it properly in a biohazard bag. Then you disinfect the area again, let it air dry, and then clean up any residue. And of course, you wash your hands thoroughly afterwards.
It's a very detailed process, but those steps are crucial for preventing the spread of infection. Now, cleaning public areas like waiting rooms and hallways must be a bit different, right?
It is. You have to be much more aware of the people around you. You use caution signs to warn people about wet floors. You try to clean during off-peak hours when there are fewer people around. You position your equipment discreetly so it's not in the way. You're also more likely to interact with patients and visitors, so you need to be courteous and professional. And you need to be extra careful about spills and messes because those can be hazards for people walking through.
So it's a more public-facing role, and you have to be mindful of how your actions impact others. What about cleaning office areas within the hospital? Are there any specific considerations there?
Well, for one, it's often best to do the deep cleaning outside of office hours so you're not disrupting people's work. And you need to be careful about confidential waste, like patient records. That stuff needs to be shredded or incinerated. And it's a good idea to regularly disinfect things like phone receivers and keyboards to prevent the spread of germs.
So even the office cleaning has its own unique challenges. Now, we've talked a lot about cleaning tools. How important is it to take care of those tools?
It's absolutely essential. Proper care extends the life of the equipment, it keeps it looking good, and most importantly, it ensures that it's actually effective at cleaning. If you don't clean your cleaning tools, they can become a source of contamination themselves. And everything needs to be stored properly in a well-ventilated area to prevent mold and mildew growth.
Okay, so clean tools for a clean hospital. What are some specific tips for caring for different types of equipment?
For dry mops, you need to comb or brush them after each use to remove any debris, and wash the mop head regularly. Damp mops need to be washed and rinsed after each use and hung up to dry completely. Brooms and brushes need to be combed or brushed and stored with the bristles up. Mop buckets and dustpans need to be washed and dried, and all cleaning solutions should be stored in tightly closed containers and labeled properly.
So taking care of the equipment is a key part of the job. And you mentioned earlier the importance of having a cleaning store. Why is that so important?
A cleaning store, or even a designated area, is important for organization, safety, and efficiency. It keeps all the cleaning supplies in one place, so it's easy to find what you need. It allows you to store potentially hazardous chemicals safely, and it helps protect the equipment from damage and dust.
Okay, so a clean and organized cleaning store for a clean and organized hospital. Now let's move on to a very specific task. Making a bed with 5 sheets. What are those 5 sheets and how do they do it?
The 5 sheets are the mattress protector, the bottom sheet, the top sheet, the duvet, and the duvet cover. And then, of course, you've got the pillowcases and any decorative linens. It's a very specific process. You start by stripping the bed, then you put on the mattress protector, the bottom sheet, the top sheet. You put the duvet into the duvet cover and place it on the bed. Then you fold the top sheet over the top of the duvet. You miter all the corners, add the decorative linens, and then put the pillows in their cases and arrange them nicely.
It's like an art form, making a hospital bed. And speaking of specific tasks, what about cleaning a toilet? That's got to be a top priority in a hospital.
It is, and they have a very specific procedure for that as well. They use a toilet cleaning basket that contains all the necessary supplies. Sponges, cloths, brushes, detergents, disinfectants. They start by ventilating the bathroom, emptying the sanitary bin, and cleaning the mirror and other surfaces. Then they flush the toilet, Apply cleaner to the sink and toilet and scrub everything thoroughly. They use color-coded cloths to prevent cross-contamination. They replenish all the supplies like toilet paper and soap. And finally, they mop the floor.
Wow, that's really comprehensive.
Yeah.
And what about the rest of the bathroom? The bathtub or shower and the floors?
They clean the bathtub or shower first, washing and rinsing all the surfaces and drying everything thoroughly. Then they replenish any guest supplies like soap and towels. And finally, they clean the floor.
Okay, so bathroom cleaning is a multi-step process, and every detail matters.
Yeah.
Now, we've talked a lot about the practical aspects of hospital housekeeping, but what about the ethical side of things? Housekeepers have access to patient rooms and personal belongings. What are some of the ethical guidelines they need to follow?
Ethical conduct is absolutely crucial for hospital housekeepers. They should never open or look inside patients' personal belongings without permission. They should never use patients' personal items. They should avoid unnecessary personal conversations with patients or visitors. They should never read patients' private documents or letters. They should never steal anything. They should always keep patient rooms secure. They should be punctual and reliable. And they should always perform their duties thoroughly and ethically without taking shortcuts.
That's about respect, honesty, and responsibility.
Absolutely. Their job requires a high level of trust, and they need to act in a way that maintains that trust.
So as we've seen today, hospital housekeeping is so much more than just cleaning. It's a complex system that plays a vital role in patient safety, infection control, and the overall well-being of everyone in the hospital. The attention to detail, the specialized procedures, the ethical considerations, it's all really impressive.
It really makes you appreciate the hard work and dedication of those who work behind the scenes to keep our hospitals clean and safe.
And it makes you think twice about taking a clean hospital room for granted. Now, we've covered a lot of ground today, but it's really just the tip of the iceberg. There's so much more to learn about the world of hospital housekeeping.